New at 6, it is encouraging. The number of COVID-19 hospitalizations continues to decline in our region. But for those with significant symptoms, those numbers don't matter. Treatment that keeps them out of the ICU, however, does. For those patients, staying off of a ventilator is crucial. And now, as Ursula Perry shows us, a new study suggests that a full dose of blood thinner may be a ticket to recovery.
When a patient's lungs are failing due to COVID and doctors are out of options, mechanical ventilation is the last resort. Researchers at the University of Pittsburgh, though, have identified a possible treatment for patients who are moderately sick with COVID. The therapy focuses on clots that are thought to form in the large and small vessels of the lungs.
The hypothesis was that if we gave medicines to prevent clot formation, we might improve outcomes or improve organ functions.
In 2 trials involving 3,300 hospitalized patients, doctors gave patients either a low dose or 1 full dose of heparin.
Heparin is well known as a blood thinner, but heparin also has anti-inflammatory properties. What we do know is that patients who were moderately ill, so sick enough to be in the hospital but not in the ICU, when started on heparin, were less likely to require ICU level of care and less likely to die.
In fact, researchers say there is a 99% probability that a full dose of heparin reduces the chance that moderately ill patients will die or will need a ventilator as compared to patients who received a low dose.
Researchers say while heparin did have an impact on those who were moderately ill with COVID-19, it did not help those that were already critically ill. The results of this study mean that in the future, probably a full dose of heparin is going to be used as standard care for COVID. Ursula Perry, KSAT 12 News.